again, I want to make sure that we understand where we are. This is the Southern Pines Land and Housing Trust organization, and they provide the space for all types of events. So if you are not already following them on social media or know their website, make sure that you talk to Asia over here. And let's just give it up for them. They do so much work for the community. So thank you.
Thank y'all.
Yes. Okay. So I know everyone's here to learn all about GI health. Just a couple of people, while I stall a little bit, can a couple of people tell me what brought you to this event in particular? Thank you for participating. So there's a lot of those things that we're going to go over today, and I do want to be clear. I have a few treatment things on my slides, but what I did not want to do is tell everyone that every product is going to work well for you. But what I do is, when I have one-on-ones with people, I really find out like what medications you're on, is there anything counter-interacting, family history. So I didn't want to put like, everyone should take this, because then I might do some of you all some disservice. So what this conversation is going to be about is specifically what are some of the conditions of the GI system? How does the GI system work? What is the gut-brain axis like, and how the gut and the brain kind of coincide with each other? And hopefully, by the time that we're done with this presentation, you know exactly how things function in your body and some of the symptoms to look for to say, hey, I might have acid reflux, or I might have SIBO. And I just want you all to be aware of those, just as you're moving through your day-to-day life. So that was my purpose of having this presentation today, and yeah, let's get started. So that's me with different hairstyle. I'm originally from St. Louis, Missouri, and I graduated. Oh, did someone say what? Oh, my mom. She don't count. But yes, we're from St. Louis, Missouri. And yes, Boss Woman Leandra will also have a presentation about her supplements that can go alongside the GI system as well. So she'll be after me. But graduated from Clark Atlanta in 2021 and received my doctorate in naturopathic medicine from Bastyr University in Seattle, Washington of 2025. So that was just last year. And I'm really passionate about holistic health education because I just believe knowledge is power. If we don't know anything about our bodies, then we are lost in the world on how to navigate what to eat, our intuition. So I really want to make sure that I provide that for you all today. So our learning objectives, by the end of the presentation, you will, capitalize will, know the following information. Basic anatomy and physiology of the digestive system. Most people have a general idea, so this won't be too complex. The functions of the gut microbiome, causes and symptoms of common illnesses, and holistic support, and a few supplements to help with GI issues. Orientation. The GI system is a continuous tube from the mouth to the anus, and it is supported by a lot of accessory organs. Some of them you may not hear about, like the liver and gallbladder today, but we'll talk about the tube in itself. Its role is to break down food, absorb nutrients, and eliminate waste. Gut-brain axis. Who's heard of the gut-brain axis before? Raise your hands. Okay, so a lot of people. So the gut-brain axis is a two-way communication network that connects the GI system and the brain, allowing them to constantly send signals back and forth and influence each other's function. This occurs through a nerve called the vagus nerve. The vagus nerve starts in the brain and it attaches all the way down to the intestines. And through that nerve, we get signals, specifically the rest and digest signals. And that's called the parasympathetic nervous system. It sends signals from the gut to the brain, and then from the brain to the gut. That's the main nerve that is in charge of this system. It regulates digestion, motility, and even mood signals. There are a lot of books out there about the vagus nerve. If you see one, you can probably understand what they're about to talk about, that gut-brain axis. Gut microbes help produce neurotransmitters. So here's a list of neurotransmitters. What is important here is that these are brain chemicals, and this is why the gut is important. It's producing chemicals that are used in your brain and your functioning to think. So that is why you see a correlation between mental health and gut issues. Some examples: Parkinson's disease, Alzheimer's disease, autism, stress, anxiety, and depression. So I don't get too deep into all of the correlations here today, but if you follow my YouTube channel, I will have a YouTube all about how the mental health components and the research between each of these diseases. Functions of the mouth. This one's pretty simple. Its basic function is chewing, and we call that mastication in medical terminology. It breaks down food into smaller particles. This forms a bolus, which is just a little circular food tumbleweed, and that helps with swallowing. The key enzymes, there are a few. There's amylase, which breaks down carbs. So a lot of people think carbs are broken down just in the stomach, but really this is why we chew, and we make sure we chew properly because the breakdown starts in the mouth. Also, we have lipase. This initiates fat digestion, but this is more active in the stomach. And then there's mucus that lubricates the food for swallowing. But what most people do not know is that there is a microbiome inside of your mouth, and it plays a role in a lot of dental diseases. Specifically, there is a bacteria called Streptococcus mutans, and it is a contributor to a lot of the dental diseases that we see. And then a lot of our sugars breaks down, and it turns into this plaque biofilm formation. So just by what we eat can change our oral health. Dietary sugars in general are metabolized, which means they're broken down to lactic acid, lowering the pH in the mouth and disrupting the balance and mineralization of the enamel. So yes, a lot of sugar can break down the enamel of your teeth. Fluoride inhibits bacterial adhesion and integrates into the matrix of teeth, making them less susceptible to demineralization at low pH. Brushing and flossing mechanically disrupts adhesion and biofilm formation. Now I'm going to give you all a little bit of a key right here. Cranberry juice. Anytime you hear cranberry juice, you can automatically think that it is preventing the adhesion of a lot of bacteria. That's why we use it in UTIs. Does it kill the bacteria? No, not really. But what it does, once you have something that kills the bacteria, it takes that bacteria and it kind of drains it out. It holds on to it and it helps flush it out of the system. So even with cranberry juice, with oral microbiome issues or teeth issues, can help move bacteria outside of your body. Conditions of the mouth. The mouth contains a complex oral microbiome, as we just discussed. Bacteria is usually swallowed, which directly influences the gut. Therefore, health can depend on microbial balance. And for example, we have gingivitis. Gingivitis can lead to another disease called periodontitis, and that is chronic inflammation of the gums due to bacterial overgrowth. This can lead to bleeding, gum recession, and tooth loss. And then the holistic relevance to this is oral pathogens can enter the bloodstream, causing systemic inflammation. This is why people who have teeth issues sometimes have GI issues as well. They're swallowing the bacteria, it's going to the gut. So yes, it can be linked to GI inflammation, altered gut microbiome, and it is associated with conditions like irritable bowel disease. I also put in Aphthous, stomatitis, which are canker sores. I feel like a lot of people have dealt with canker sores to one extent or another. This is a common condition causing small, painful ulcers inside the mouth. This is typically appears on the inner lips, cheeks, tongue, or soft palate, and it is not contagious. But the key features are these round ovals, and I tried to put some examples up there. and it has that white border. Sometimes it can be yellowish, and it's very painful, especially when eating and speaking. They heal on their own in 7 to 14 days, but the causes can be a variety of things. It could be local trauma from biting your teeth, stress hormone changes, but the biggest one that I want you all to see here are the food sensitivities and nutrition deficiencies. And I see someone with Aphthous stomatitis, most times it's linked to a low iron, low B12, which is something that I never knew growing up because I had them, but I also have low iron. I had low iron for a long time. So that was probably the cause of why I was getting these sores. It also can be an immune dysregulation issue, and it can be associated with irritable bowel disease, celiac disease, and overall gut inflammation and malabsorption. Are we doing okay? Good. Okay. Now we have conditions that can be related to high sugar diets. And also, before I continue, I do want to let you all know that nothing on this presentation is a diagnosis. I don't want you all saying, oh my God, I have this or that. But this is just general information. So I'm not diagnosing anyone, okay? No one's going to walk out saying I diagnosed you. Good. I should have said that at the beginning. Okay, so dental caries and cavities. This is the breakdown of the enamel from acid-producing bacteria. All of these are related to high sugar diets. And with cavities, it reflects a microbial imbalance, and it can show that your dietary pattern. This can cause early signs of dysbiosis, which is when the bacteria in your gut starts to, the wrong bacteria starts to overgrow. Also linked to high sugar diets, as I said before. And then you have oral candidiasis, or thrush. This is an overgrowth of a fungus called candida in the mouth. Candida can also overgrow in other areas of your body. The holistic relevance, it is a fungal overgrowth in the GI tract, and is often linked to antibiotic use, high sugar intake, and a weakened immune function. Antibiotics, word on that. What happens when we take them for too long? Antibiotics, they kill bacteria, right? So all bacteria isn't bad bacteria. We know there's bacteria that is in our gut that's helping us break down things. Some in our mouth, and we need a good equal amount of good bacteria, bad bacteria. Mostly good though. What happens? We kill the bad bacteria, we kill the good bacteria. Okay, but what can grow? Fungus. So people who are using antibiotics long term end up having fungus overgrowing because they killed off all the bacteria that was attacking the fungus. Now let's move on to the throat. The primary function is to act as a passageway for food and air, and it coordinates swallowing. So what happens with swallowing? You have two tubes. You have a trachea, which is a voice box in the front. Can everyone touch your trachea? Okay, this is also where the thyroid lives, but your voice box is in the front. In the back, we have an esophagus, and that goes straight into your stomach. In order to prevent food from going to the wrong tube, your body will shut off one tube when you swallow, and it goes down to the right place. But then, us as greedy people, naturally, we eat the fries too fast, and you're drinking your water fast, and then the food goes to the wrong tube, and you get a choking reflex because your body is trying to push that food up and out of the wrong tube. That can actually cause really bad issues. So epiglottis, that is what closes the airway or the trachea during swallowing to ensure that food goes to the esophagus. And it also prevents food from going into the lungs. Let's go into esophagus. The primary function of the esophagus is to transport food from the pharynx to the stomach. And the word peristalsis is something that a lot of doctors use, which is the rhythmic muscular contractions that move the food bolus downwards. The biggest thing that I want you all to pay attention to here is the lower esophageal sphincter, which prevents acid reflux. So, of course, we have our stomach, which is on the left side of our body. So, right around here, our esophagus comes down, it hooks in our stomach. but the stomach is full of acid. So we need something to block off the acid from coming back up and burning us, right? So that's where the esophageal sphincter, they initiate, or initials LES, helps prevent that acid from directly moving into our throats. But, of course, that's not always functioning, and we're going to get into GERD, or acid reflux, in a second. Okay, so let's get into acid reflux, also called gastroesophageal reflux disease. And what is it? This is stomach acid flowing back into the esophagus. It happens when the lower esophageal sphincter relaxes or weakens, so it's not constricting back after your food goes down. It's just kind of like staying open, it's weak. And this causes inflammation and irritation over time. So acid, of course, coming back and harming the tissues in your esophagus is not good. So you'll feel burning in the chest. That's why they call it heartburn. A sour taste, or the feeling like you have to throw up, which is regurgitation, bloating, or belching. You can also develop a chronic cough or throat clearing, trouble swallowing, and then the symptoms can be worse after eating or lying down. This can lead to a condition called Barrett's esophagus, and that's just the cells are so damaged they turn into a different type of cell, and that can be precancerous. So medications, typically they put you on something called omeprazole, and that's a proton pump inhibitor. What that is doing is decreasing the acid overall in your stomach. But you only want to be on that for 8 weeks. Sometimes I find that people are on proton pump inhibitors like omeprazole for a year or two. And that is no good, because now you don't have any acid in your stomach. So some supplements that you can consider, one is Tums, antacids, but that's not curative. That's just helping you deal with the symptoms. Baking soda is one that people use as well, but the one that is most naturopathic, I will say, is the deglycyrrhizated licorice, or DGL. And the reason why we want that specific form of licorice is because regular licorice has the glycyrrhizated component to it, and that can actually aggravate GERD. So don't just say, oh, I'm going to get some Twizzlers or some licorice tea. No. You need to get DGL specifically to help calm your GERD symptoms. And then what triggers it? Large meals, spicy or high-fat foods, caffeine, alcohol, chocolate, eating late at night, tight clothing, stress and anxiety, which makes everything worse, and also smoking. So, also along with this, what can help it is everything, the opposite of everything that's in this yellow box. Eating smaller meals, trying to control whether you're eating a lot of spicy or high-fat foods. Now, everything in here is not going to trigger everyone. Some things trigger people and some things don't. So it's really important for you to decide, okay, every time I eat chocolate, I'm okay, but when I have that spicy quesadilla, I'm not feeling too well. So that's how you go about knowing what's good for your body. Okay, everyone okay? Okay. Then we have esophagitis, and this is the inflammation of the esophagus. Anytime you see itis, that means anything that comes before it is inflamed. So, gastritis, I'm thinking inflammation of the gastric area, the stomach. Esophagitis, the esophagus is inflamed. So, inflammation of the esophagus, it most commonly occurs when the lining is irritated or damaged in the esophagus. And it's often caused by stomach acid as well. So, sometimes acid reflux and esophagitis can occur together. And as you see, acid reflux is usually the cause, but there's also some medications that can cause esophagitis, infections, allergic immune reactions, and then some irritants like alcohol, smoking, very hot or acidic foods. But I want to go back to the allergic and immune reactions. That if a person is having some issues with their throat and they have allergies, please consider esophagitis to be part of the cause. Common symptoms will be heartburn or burning chest discomfort, painful swallowing, difficulty swallowing, stress sensation or food getting stuck, and then regurgitation of acid or that acid taste in the mouth. So, yes, there's something I want to say about this. Okay. Usually people go to the hospital because they're thinking that they're having a heart attack. And I want to let you know you should definitely go to the hospital if you think you're having a heart attack. But if you just ate, something spicy or irritant, please consider maybe it's acid reflux or esophagitis. Not saying don't go to the doctor. I'm not saying that. Please go, but consider this to be a cause of chest pain as well. GERD, esophagitis, all of these things can cause chest pain. Hiatal hernia, what is it? This is a condition where a part of the stomach pushes through the diaphragm into the chest cavity. So I have a picture right here to your right, and a normal diaphragm, which is kind of what lifts and falls as you breathe. There is a weak diaphragm. That part of the stomach can go into your throat, and that is what we call a hiatal hernia. This can interfere with the function of the lower esophageal sphincter, which of course will make your symptoms of GERD probably a lot worse. And some of the causes can be increased abdominal pressure. That can be anything, including obesity, pregnancy, chronic coughing or straining, heavy lifting, and genetic predisposition. Common symptoms, there's usually not a lot of symptoms that people can list off, but when it's present, it's usually related to heartburn, regurgitation, or chest discomfort. Symptoms may worsen after eating and when lying down. So for hiatal hernia, we want to treat with lifestyle first, of course, smaller meals, avoid lying down after eating, elevate your head during sleep, and reduce those trigger foods. Medications, there are acid reducers like antacid, H2 blocker just means you're reducing the acid as well, and proton pump inhibitors like omeprazole to manage symptoms. But this does not help treat the hiatal hernia in itself. Some people need, I think, surgeries for this, but a lot of times there's other ways you can help fix hiatal hernia. Have you guys ever heard of cupping? Cupping? So that's pretty much, it's like a tool. I don't know if you've ever seen people with those big red circles on their back. I've seen doctors take a cup around the stomach area and put a little tension down and let it sit, and the hernia will come and correct itself. Now, I'm not suggesting this as your treatment. I'm just saying I heard from around the way that could be an option. But of course, surgery is if it's really severe. It can repair the hernia and strengthen the lower esophageal sphincter when symptoms persist or complications develop. Because even if you do something like a cupping situation, that may not fix the fact that your diaphragm is weak or like the main cause. It just will put it back in place just for it to probably lift back up. So just some considerations there. And also just reduce pressure on the abdomen. Maintain healthy weights, avoid straining while doing anything, and wear loose clothing. Stomach. So primary functions is to store and churn the food. It forms, this is just another word for food that's in the stomach. It's called chyme, but it's just a little bit more digestive. And then it begins protein digestion and acts as a defensive barrier, and acid actually in the stomach kills a lot of the pathogens that you have eaten. So, naturally there's going to be things on your food, right? But your stomach is going to take care of that, and usually we don't see the effects of the things on our food. So the key secretions is hydrochloric acid, which lowers the pH of the stomach and activates a lot of enzymes. And then there's enzymes that helps break down proteins to peptides, and it also has intrinsic factor, which is required for vitamin B12 absorption. Conditions of the stomach. We have peptic ulcer disease. What is it? This is a condition where there are open sores or ulcers developing in the lining of the stomach or the upper small intestines, which is the duodenum. That's what that part is called. And it occurs when the protective mucus layer is damaged, allowing acid to injure the tissues. Causes. Usually caused by a H. pylori infection. It also can be caused by long-term use of non-steroidal drugs, ibuprofen, aspirin, naproxen. All of these things can lead to a person having an ulcer. One thing that I want to point out here is that people who are having stomach issues, maybe stomach burning, also maybe anemic. That's one thing I always think about. Do they have an ulcer? Because after a certain age, why are you anemic? That's not really common. They may be bleeding from somewhere, whether in the colon, it could be in the stomach. So, and usually I ask, are you taking ibuprofen every day? Yes, and people are, and no judgment, but that's what can be a cause of peptic ulcer disease. Also, excess acid exposure or impaired mucosal protection, smoking, which delays healing and increasing the recurrence risk, and then alcohol use and chronic stress can be contributing factors, but it may not be the primary cause. And then common symptoms, you'll feel a burning or a gnawing upper abdominal pain. That's like right in here. Pain that may improve or worsen with eating, and it depends on the ulcer type. Gastric ulcers, that one will be worse when you're eating, and then duodenal will be worse afterwards because it takes a while for that food to get into the small intestine, so it may take a while before you're like, oh, that's kind of painful. But that's the biggest symptom there. Bloating or early fullness is a good sign of peptic ulcer disease. Nausea, and in more severe cases, GI bleeding. Now, if you ever find yourself with black stool, black poop, or vomiting blood, this could be a GI bleed situation. But black poop, that's the one that I want you guys to pay attention to, because that means that you are bleeding somewhere. If it's bright red, it's probably lower down. It's probably like your rectum or something that's the issue. But if it's dark, that means it's coming from far up. So it may be coming from the stomach. But black, not like dark brown, that would have to be black. Treatment. If it's caused by NSAIDs, which are that ibuprofen, aspirin, stop NSAIDs. Also, full dose proton pump inhibitors for 8 weeks. If it's caused by H. pylori, you will have to get quadruple therapy, meaning that you need 4 medications. Sometimes they combine some of the pills, so it's like 2 or 3, but it's usually a proton pump inhibitor to, lessen the acid, the bismuth, tetracycline, metronidazole. So,
what is H. pylori?
It is a type of bacteria. It's a type of bacteria. Some people.
It's no fun.
It's no fun, and it's hard to get rid of. There is a breath test, I believe, that people do to test for H. pylori. So, if you feel like you're getting any of these symptoms, that would be a good one to ask your doctor about. But thank you all for sharing your stories. This is a safe place to do that because people can learn a lot from these stories.
That's serious stuff.
Yeah, this is serious. So this is why, if you have a phone, please take pictures of whatever slides. I'm not, hoarding anything. I want you all to know these symptoms. The black stool.
Is there any way if we gave you our email address, would you email it?
Well, yes, I have a QR code at the end where my email, everything will pop up. But I want you all to be able to know what this looks like, hear some stories of what it may feel like, and just know if you're above a certain, if you're older in age, you shouldn't really be anemic. there's anemia, you need to investigate why. Don't let someone just say, oh, just take some iron. But why do I need to take iron? For a lot of times it's women who are menstruating, and that's why we're losing blood, so that's obvious. Other times it's not so obvious, and it could be bleed somewhere along the GI tract. Gastritis. What does itis mean? There we go. So this is inflammation of the, there you, stomach. Good. What is it? Inflammation of the stomach lining can be acute or chronic, which means it can be sudden or long term. And it may weaken the stomach's protective barrier, increasing sensitivity to acids. This can also be caused by H. pylori, and usually is the chronic cause. Long-term, NSAIDs. You're going to see that pop up a lot. Alcohol use, you're going to see that pop up a lot. Emotional stress will pop up a lot. Bowel reflux and autoimmune processes, which are, less common. What you'll feel is upper abdominal discomfort or burning, nausea or vomiting, bloating or early fullness when eating, loss of appetite, and sometimes there are no symptoms, especially in chronic diseases. In more severe cases, you will also see some dark stools, which means bleeding. Dietary and lifestyle changes. Always know that the root cause is always going to be to avoid what is causing the issue. So that could be alcohol, caffeine, nicotine, spicy foods, fried foods, and acidic items. That's like citrus fruits or tomatoes. Again, this may not be the same list for everyone. This is just some of the things that it happens in some people, some that happens in other people. Dietary adjustments. We want to eat smaller, more frequent meals, consume low acid and high fiber foods. Also manage stress. Stress causes everything, y'all. So just, please talk to someone. Meditate, therapy, we're past the days where there is a shame behind getting some help because it can affect your whole body, especially your gut. Also, limit the insects. We already talked about that. You try to find other ways for pain relief if you can, if possible. I'm not going to say don't ever take.
Now, insects are aspirin. Is that right?
Aspirin is part of insects, and I can pull up intestinal microbiome. So what is the microbiome? It is trillions of microorganisms, bacteria, fungi, viruses that live in the GI tract. Majority reside in the large intestine, and it functions like a metabolic and immune organ. The key functions: digestion, so it breaks down fiber, and it produces something called short-chain fatty acids. It also helps with immune regulation, and this trains and modulates different immune responses. Barrier support, it helps maintain the integrity of the gut lining, and it also helps produce neurotransmitters, which influences the gut-brain axis, as we talked about earlier on today. So if you have a balanced microbiome, this supports digestion, immunity, and overall health. But if you are in dysbiosis, meaning that the wrong type of bacteria starts to overgrow, it can lead to inflammation, poor digestion, and disease. So this is going to follow us into the small intestine. The small intestine is a major site of digestion and nutrient absorption. It absorbs amino acids, sugars, fatty acids, vitamins, and minerals. The key input is the bile, which helps to emulsify or break down the fats, and then you have some other enzymes in there that helps with carbs, proteins, and fats again. So the structural advantage, you have these, I'll show it to you. This right here is kind of how the small intestine looks. There are these villi and microvilli that help increase the absorption of foods. This is where you can get your vitamin intake in. But you see how tight these cells are? These epithelial cells, how they are really close together. We're going to talk about leaky gut in a second, but I want you guys to get that visual representation when we say intestinal permeability. When you hear someone say intestinal lining, we're talking about that those tight junctions, right, in those pictures of those cells that are really close together so that nutrients can come through and there's no weird gap that's leaking, things leaking through that's not supposed to leak through. Okay, talking about small intestinal bacterial overgrowth or SIBO. This is really, really, really common. This is an overgrowth of bacteria in the small intestines. And so when I'm saying this, again, we're saying there is healthy bacteria in the intestines already. But somehow they can overgrow, and that leads to a lot of symptoms. It leads to fermentation of food too early. And that is what causes a lot of the bloating and gas, because the bacteria is fermenting all this food, and now you're having so many symptoms because there's too much bacteria doing too many things. Rather than a normal amount that can kind of slowly digest things the way it should, it's almost like moving too fast because there's a lot of bacteria in there. Risk factors include slow, impaired motility or slow transit. And what I mean by that is, let's say your body is digesting, but it's digesting slow. Gives bacteria a lot of time to just kind of be like, okay, we can live here for a second because we're not going nowhere. You know what I'm saying? So that is, impaired motility can cause SIBO. Low stomach acid. History of GI infections. Structural issues like surgeries or adhesions. Also chronic stress, which can affect gut-brain signaling. Common symptoms, I said this, bloating, often shortly after eating, excessive gas, abdominal discomfort, diarrhea, constipation, or both, and nutritional deficiencies in chronic cases. The person who's showing me a lot of, low iron, low B12, all of these things, and they're having stomach issues like this, I'm going to be like, you probably have SIBO. It's very common. And treatment considerations, this is the important part. There are different types of microbes which will produce particular gases. This is why it's important to get tested for SIBO. A lot of people are like, okay, I have SIBO, let's just take the antibiotics and be done with it. Well, there are different types of gases that can be produced, and some antibiotics may not work with that particular gas. So hydrogen and hydrogen sulfide are produced by bacteria, which is the SIBO, but there's also methane. And if that is produced by archaea, and that's just another type of microbe that can survive very harsh conditions, whether it's like high boiling points, whatever. So then an antibiotic is not going to help if you have a methane producing microbe. So I put that here. Rifaximin is usually the antibiotic of choice that doctors give patients, but it will not respond to methane or hydrogen sulfide. So that's worth knowing. Also, there's rifaximin, there's herbal antimicrobials as well, and usually how a naturopath would treat it, they'll put different herbal supplements in rotation because, like antibiotics, sometimes bacteria gets used to it. It's like, oh, we know how to deal with you, and they replicate that. You know what I'm saying? Like, there's so many thousands of them are being produced at any one moment. So after they figure out what the deal is with one antibiotic, they're already changing and mutating, and they're like, okay, we're going to survive, and that is going to stop working. So rifaximin gets it really quickly. It's not always covered by insurance. It can be up to $800, $900. So and that's why people are like, well, let's go the herbal way. Well, the herbal way, you might have to buy a lot of supplements to get rid of it. So this one's a really tricky one. If you're treating the wrong thing, this is why we need to get tested. If you're having a fungal overgrowth issue and not a bacterial overgrowth issue, then you're going to make the fungal overgrowth worse by giving yourself a whole bunch of antibiotics. So antibiotics are good if you have the issue because it's going to lower the bacterial load in a bacterial overgrowth situation, but not if you don't have a bacterial overgrowth. I have a whole slide on leaky gut. I know, I'm like, everyone's like, what's with the leaky gut? Let's get it. Leaky gut. Remember we talked about that intestinal lining? Now we're starting to see some gaps, and guess what's going through? Some pathogens, bacteria. So what is it? Increased permeability of the intestinal lining. The tight junctions between cells become less selective on what can go through and what cannot. It allows substances to pass into the bloodstream more easily. We have some what passes through. We have undigested food particles, bacterial fragments, some toxins, and this contributes immune activation and inflammation. What contributes to leaky gut? Gut dysbiosis, microbial imbalance. When we're talking about that microbiome, that's what I mean when I say dysbiosis. Chronic inflammation anywhere in the body, especially in the gut, can lead to leaky gut. Stress always can cause issues. So there are certain bacteria that will just not grow if you are stressed out. And if that's not growing, something else is. So it's really, really particular. The microbiome is so important to stay in balance. And stress by itself will just tell a bacteria, oh, we're not going to grow here. We don't like this life. And another bacteria is like, we do like this life. And that can cause issues because the wrong bacteria can start to grow just from stress. It's crazy. Poor diet and highly processed foods and alcohol cause leaky gut. Infections or medications, certain antibiotics, NSAIDs, again, non-steroidal, anti-inflammatory drugs, thank you for that. And then symptoms, digestive, bloating, gas, abdominal discomfort, diarrhea, constipation, food sensitivities, or intolerances. You can also have systemic symptoms, which is the whole body. So fatigue, low energy, brain fog, headaches, joints pain, or muscle aches. Immune and inflammatory signs includes increased sensitivity to foods or environmental triggers, skin issues, rashes, eczema, low-grade chronic inflammation, can all be because your gut is not working properly. And then I give you guys a freebie at the bottom, L-glutamine. L-glutamine. This is often used to support intestinal permeability. It helps pretty much tighten up that gut lining.
Is that glutathione?
No, it's not glutathione. It's glutamine. So Glutamine. Now, I would say talk to a provider, do your research, contact me. Because you can't just dose anything with L-glutamine. So you can take too much, is what I will say. There is a therapeutic range that is used for certain conditions. Leaky gut will be in that category. So, but if you want to just go ahead and do your own research and like, hey doctor, hey, scholarly articles, what is usually the therapeutic dosage there, you can do that as well. But just be careful when you're doing anything on your own. Okay.
Plus, if you're on medications, we'll make sure.
Plus, if you're on medications, you'll need someone to help check to see what works well with the medications. Yeah, I don't know who that is. Yeah. All right. Celiac disease. What is it? This is an autoimmune disorder triggered by ingestion of gluten, which is a protein in wheat, barley, and rye. It causes the immune system to attack itself. It's attacking the lining of the small intestine. Anytime you hear autoimmune, that means what research is saying is that your body is attacking some part of itself. Yes. I'll just leave it there. This leads to damage of the villi. Remember we talked about the little villi that helps with absorption, the little finger-like projections. And once the villi is attacked, what we cannot do is absorb nutrients. So the causes or the mechanism, immune reaction to gluten, which leads to inflammation in the small intestines, progressive damage to villi or villus atrophy, and results in malabsorption of nutrients. Common symptoms, diarrhea or constipation, bloating and gas, fatigue. The big one to me is weight loss or nutrient deficiencies. And then it can also present with non-GI symptoms like skin, changes in mood, and anemia, which is iron B12 being low. So I'll just say that the biggest way to treat this is just to not eat it. But that's usually what all of the diagnostic tools, like, what do you do? Don't eat gluten, which sucks, but there's so many gluten-free options now than there were before. I feel like every section, gluten-free pasta, gluten-free. So just take advantage of that, but also be careful because there's misadvertisement sometimes. So,
X amount of gluten.
exactly, right? So, yeah, food is tricky, but that's going to be the treatment here. Large intestines. This absorbs water and electrolytes, forms, stores, and eliminates food, houses the majority of the gut microbiome, and the microbiome role is to ferment undigested fiber, which produces short-chain fatty acids, which we talked about, and it supports immune function, gut barrier integrity, and metabolic health. Irritable bowel syndrome. This is a functional GI disorder characterized by abdominal pain and altered bowel movements. Functional meaning there's no visual structural damage or standard testing, but it involves dysregulation of the gut-brain axis. It affects motility, sensitivity, and digestion. Common symptoms, abdominal pain or cramping, often relieved after a bowel movement, bloating and gas, changes in bowel habits, and then there's IBS-D, which is diarrhea, the diarrhea type, IBS-C, which is the constipation type, or it can be alternating, IBS-L. So those are just diagnostic terms for you to know. Underlying mechanisms, altered gut motility, too fast or too slow digestion, increased visceral sensitivity, which visceral meaning organ sensitivity, which can cause a heightened pain response, microbiome imbalance, nervous system dysregulation, and stress response is usually involved in that. It can be triggered by stress and emotional factors, certain food, which varies by an individual, hormonal changes, post-infectious changes in the gut, and the treatment is usually to just address food intolerances and treat whatever the root cause is. The one that most people are familiar with is the irritable bowel disease. This is a group of chronic immune-mediated inflammatory conditions affecting the GI tract. It's characterized by ongoing inflammation and tissue damage. This is where you have Crohn's disease and ulcerative colitis. Crohn's disease can happen at any part of the GI tract can be affected, and usually there's this cobblestone appearance that will happen on imaging, and then it's like a skip lesion. So one area may be affected and then another is not, and then another area is affected and then another is not. And then you have ulcerative colitis, which is more continuous, but it's limited to the colon. So the common symptoms, persistent diarrhea, may include blood or mucus, abdominal pain and cramping, fatigue, weight loss, urgency with bowel movements. The underlying mechanism, the immune system is overactivated and it attacks the intestinal lining. Disruption of the gut microbiome and the intestinal barrier can be an issue that causes irritable bowel disease. Genetic and environmental contributions are always in the background of everything, but I just made sure to put it here randomly. I'm glad I did. Why does this matter? It can lead to nutrient deficiencies, systemic inflammation, and it requires medical management, bolded, alongside lifestyle support. Rectum and anus, primary function. Rectum stores feces before elimination, and then the anus controls the release of the stool through sphincters. There's a sphincter that opens and closes whenever you're ready. It's ready. So key mechanisms, well, sometimes.
Yeah.
sometimes. Right. So, defecation reflex triggered when the rectum stretches. Internal anal sphincter. This is involuntary, meaning that your body naturally controls this, so we're under autonomic control. External anal sphincter is voluntary control. This is the one where you're like, oh, don't use it on myself, and then you can just let it go when you're ready. So, two different sphincters that are working there. Holistic insight. Healthy elimination depends on proper motility, adequate hydration and fiber, nervous system balance, stress response. This function may lead to constipation, diarrhea, and then straining contributes to hemorrhoids, which is our next topic. Hemorrhoids. What are they? Swollen, inflamed veins in the rectum or anus, similar to varicose veins, but in the lower GI tract. The type, you can have the internal, which is inside the rectum. Usually this is painless, but you might find bleeding when you wipe. The external ones are the ones that are a little bit more painful, and that's under the skin around the anus. Causes and risk factors. Chronic constipation or straining, prolonged sitting. This is getting worse amongst the younger generation because, you know, we just kind of like to do this while we're using the bathroom. And then you're sitting there forever, and now you're like, why does my butt hurt every time I use the bathroom? Because you got hemorrhoids. I would know. But low fiber diet, pregnancy increases the chance of hemorrhoids, and increased abdominal pressure. Common symptoms, rectal bleeding, the bright red blood. Remember, if it's dark black, that might be something else. Itching or irritation, pain or discomfort, common with the external ones. Swelling or lumps near the anus. Prevention includes increasing fiber and hydration, avoid straining, supports regular bowel movements, limits prolonged sitting. Sometimes we just got to get up, y'all. Instagram can wait. And then we have, I put a squatty potty. I don't know if you guys ever seen those, but it's kind of like the ancestral way of using the bathroom. You know, you just used to hit one of these, but you can't hit one of those on the toilet. So that's what the squatty potty helps you get back into that ancestral way of using the bathroom. But it does help. It helps move things exactly the way they need to be moved. So, also witch hazel wipes. That helps with varicose veins. Yeah, hemorrhoid creams work. They usually have witch hazel in them. That's which is a herb. Yeah. I always forget about the weightlifters because that's not part of my lifestyle, but that does cause the hiatal hernias, hemorrhoids, it does all of those things as well. So thank you for bringing that up. Okay. Constipation. If you guys could just snap a picture or something. This is how to get rid of constipation. Fitness, fluids, fibers, balance the flora, and try to use the bathroom at a regular, same time every day. I think this is pretty self-explanatory. Please look up what high fiber foods are so you just know what those are. When you're ever constipated, you have this to reference. Or just email me and I'll send it to you. Gotta move. Diarrhea. The biggest thing here, there's different causes of diarrhea, but if you're not treating it and it's long-term, it can kill people, which is, we actually have seen it.
Dehydration?
Yeah, it can be from dehydration just because you're losing so much fluid. There you go, you got it. So make sure you're having electrolytes alongside of your fluid, because fluid moves through something called an osmotic gradient. Wherever there's particles, salt, water will follow that. So if you need to also that means your electrolytes are leaving with the water, is pretty much what I'm saying. So you need to replace the electrolytes alongside of the hydration. And I'm going to just say a lot of electrolytes have a lot of sugar in them. Just be aware of that. The ones that really do well don't taste good. Some of them do, but I just know the ones that the doctors I worked with, they drunk those, and I was like, this is healthy.
Dr. Paris, what about now? I try the salt salt thing sometimes, but I get paranoid because I thought that salt could also be like a laxative.
It can. It can. So when I say a pinch, and this, I just do electrolytes. I don't like to play around. But when I say a pinch, it's like a pinch. Because yes, back in the day when I was young and dumb, I used to just put a whole bunch of salt in my water and drink it, and I thought I would be skinny the next day. And sometimes it worked, but I was. But don't do that. Don't do that. Don't do that. That was just my 1920. Like, we're going to the club tomorrow. I need to, so. But we're not doing that to induce diarrhea. Let's see who was paying attention. I wish I had a ruler, but no, I'm not trying to traumatize no one. What causes acid reflux? Low stomach acid, bad flow of stomach acid into the esophagus, lack of fiber, food intolerance.
B.
Okay. My students. All right. I could have done this as a professor, okay? All A's. Gastritis. What does itis mean? Okay, what's the answer? Hey! Period.
You're a good teacher.
Thank you for that. What is a peptic ulcer? A tear in the esophagus, a virus in the stomach, a sore in the stomach or small intestinal lining, or a blocked colon. See, a sore. Okay. What bacteria can cause peptic ulcers? H. pylori. I heard it. Yeah, that was kind of easy, but it's good to know. SIBO. Is it too little bacteria, too much bacteria, a colon infection, or food allergy?
Too much.
Too much bacteria. Good. Overgrowth. That's what the O stands for. What does leaky gut mean? The stomach produces too much acid, the intestines are shorter than normal, the gut lining becomes more permeable, or the colon stops working. C. What is celiac disease caused by? Or let me reword this. What? Well, yeah. What? Yeah, B. Thank you. Y'all must have been some A+ students. And y'all like B. Okay, that's it for me. Please take a picture. Make sure that you save the QR code. That's where my website is. Email me, drparrisgrady@gmail.com. And I'm on Facebook, Instagram, everywhere.